Moving on to the U18 Sports Medicine Timeout, brought to you by U18 Sports Medicine, your sports medicine provider for the young athlete. And joining us now is Dr. Jeremy Frank. And Doctor, thanks for being with us. And
my pleasure.
What we're going to talk about in this segment, very important, knee injuries, especially the ACL injury.
Absolutely. You know, there's more and more kids playing sports at younger ages. They're concentrating on a single sport year-round, and they're traveling on all-star teams. And so with this increased demand on kids' knees, we're seeing more and more ACL injuries in the young athlete. And it's kind of become something that's very imperative for the orthopedic surgeon and the pediatric orthopedic surgeon to recognize early and treat effectively so that we forestall any progression to arthritis later on.
Some of these injuries, I guess, as you mentioned, are attributed to overuse. Kids are playing a ton of games more than ever before.
Absolutely. You know, kids are on a traveling all-star team. Sometimes kids come in and they're three-sport athletes. Some kids start playing a single sport and are sport-specific and concentrating on that sport starting at 5 years old. And so it's something that we really have to watch out for, that kids don't overdo their particular activities and cause an overuse injury to their knees.
All right, they have an ACL injury. What are they looking at?
Instability of the knee, swelling, pain, an audible pop, inability to cut, pivot, or turn quickly on your knee.
Probably also looking at surgery and quite a bit of rehab.
Yeah, down the road what happens is, depending on the age of the kid, we would evaluate the knee and determine, is this a patient that needs surgery? If they do, then after surgery they'll be in a brace for a while, they'll need physical therapy, and it's typically about 6 months before someone can get back to the field after surgery.
All right, Doctor, thank you very much.
My pleasure.
Dr. Jeremy Frank joining us with our U18 Sports Medicine Timeout.